incredible health news this morning. A new personalised cancer vaccine could soon be available to Australians. Today, Melbourne reporter Christina Hearn has more. Chris, this is a major breakthrough.
Carl, it is being hailed as a true breakthrough. It is a personalised cancer vaccine and it is based on for melanoma treatment, and it is based on the genetic testing of a patient's own tumour. So how it all works is that once the tumour is removed, this vaccine is injected every 3 weeks over the next 7 months. And a recent trial has found that the risk of recurrence of that tumour is reduced by 44% in those patients that have received the vaccine. It is hoped that it will be available for eligible patients in Australia next year. Moderna is also working on a groundbreaking vaccine for the respiratory illness RSV. It's currently undergoing stage 3 clinical trials, and it is hoped that it'll be available here in Australia by winter next year. But the long-term goal is to manufacture it right here in Melbourne at the Moderna plant, which is scheduled to open in 2025.
Some significant health news. A personalised cancer mRNA vaccine is being hailed by Melbourne scientists as the start of a true breakthrough. Joining us to explain it all is today medical expert Dr. Nick Coatsworth in Canberra. Doc, thanks so much for your time. I mean, this sounds so incredible. How exactly would it work?
Sarah, so many things in medicine are hailed as breakthroughs, but I think this one could truly be named as such. Basically, you take cancer cells from a patient with advanced cancer, in this case melanoma, and you use them to construct a vaccine, which you then re-inject, and the body's own immune cells start to attack the cancer. Now, that has resulted in quite an extraordinary reduction in recurrence and death at 18 months in results just presented in the United States for patients with advanced melanoma, a reduction of 44% when you get the vaccine in addition to standard immuno and chemotherapy.
This stuff is so incredible. I mean, it's just science, eh?
Science, eh? Oh.
It's mind blowing, isn't it? And I think a lot of us in medicine never really thought that we would see cancer vaccines, although obviously they've been in the pipeline for a long time. We didn't think we would see them in our lifetimes, but here they are. And I think the advances, we've got a lot to thank. The pandemic was impossibly difficult for so many, but it really did give us some real leaps ahead in terms of the technology that we're able to use in medicine now.
Give us some real leaps ahead in terms of the technology that we're able to use in medicine now.